What do Michael J. Fox, Muhammad Ali, Johnny Cash, and Pope John Paul II all have in common? They all have or had Parkinson's disease. Parkinson's disease affects over 1 million people in the United States and an estimated 7 to 10 million worldwide. The disease affects the way that people, normally men over the age of 50, move. It causes tremors or involuntary muscle movement to occur when one isn't moving, commonly known as a resting tremor, difficulty walking, monotone, and many other symptoms. This disease affects the normal functions of a person. It makes it difficult for the patient to complete common movements on their own. Scientists and doctors have been exploring new drugs, courses of treatment, and exchanging ideas and research to help find a cure to improve the lives of those living with Parkinson's disease, or PD. Parkinson's disease, discovery of drug development and the road to a cure. When first identified, the disease was known as the shaking palsy.
The first researcher of the disease was James Parkinson, an English physician. He studied 6 cases from within his practice and wrote the first detailed analysis about the disease in his paper called An Essay on the Shaking Palsy in 1817.
He defined the shaking palsy as involuntary, tremorless motion with lessened voluntary power in parts not in action, and even when supported, with a propensity to bend the trunk forwards and to pass from a walking to a running pace, the senses and intellects being uninjured.
This means that Parkinson observed that patients experienced unsteady balance. Despite these symptoms, the patient's mental functions and senses were not affected by the disease.
In the essay, he describes the most common feature of the disease, tremors, the difference between the shaking palsy and other trembling disorders, his own thoughts on the disorder, a number of additional cases, and in the final chapter, he discussed his hopes for successful trials for treatment.
60 years later, Jean-Martin Charcot, a French neurologist, studied the disease. His work consisted of studying patients at the Salpêtrière Hospital in Paris. He observed many patients with tremoring disorders and performed tests to learn more about the disorders the patients were suffering from. Charcot studied these patients with the initial observations of Parkinson in mind. After the death of the patients, Charcot would perform autopsies to learn more about the cause of their discomfort. Charcot was the first to recognize the difference between Parkinson's disease and multiple sclerosis. Charcot found that patients with MS had no resting tremor, but a faster tremor when in motion, while patients with Parkinson's had a resting tremor and slowness of movement.
Later in his research, he noted that Parkinson's patients felt great relief after riding on a horse, in a carriage, or on a train. He created a vibratory chair that was used as part of patient treatment. He found that 30-minute sessions multiple times a week improved symptoms and sleep for these patients. Although this treatment helped to alleviate symptoms, it was not a cure. Today, scientists still don't know why motion and physical therapy help, but they do know that more active patients live lives with better balance and posture. After 60 years of working and exchanging data, scientists had a breakthrough in 1957. They discovered that dopamine was an independent neurotransmitter in the brain. Dopamine is a chemical in the brain that is released onto adjacent cells from a section deep within called the substantia nigra. From there, the dopamine sends signals all around your body to allow smooth, coordinated muscle movement. From there, researchers created an instrument to help measure the level of dopamine in the brain. The tool helped scientists to determine that people with insufficient dopamine levels were the ones that suffered from Parkinsonian symptoms because their brain wasn't sending out enough dopamine. Resting tremors occur because there is not enough dopamine to tell the muscles to stop moving. After a decade of exchanging research, experts developed the first drug used to treat the symptoms of the disease. This miracle drug was called levodopa and was a huge milestone for treatment of PD. Levodopa, or L-DOPA, is transported to the brain and is then converted to dopamine to increase the amount of neurotransmitters that are being sent out across the body. When more neurons are being sent out, the body is able to move with fewer tremors and more smoothly. L-DOPA was the first drug to give any relief to patients with Parkinson's and still is the main treatment for symptoms today. This drug is considered the gold standard in treatment.
Although levodopa was such a big advancement in treatment, it was not perfect.
It has become abundantly clear that levodopa therapy has its limitations. Because of its short half-life, prolonged use of levodopa in high dosages results in motor fluctuations and dyskinesia. In addition, as the disease progresses, multiple non-levodopa responsive symptoms appear. These include neuropsychiatric problems like depression, dementia, confusion, hallucinations, autonomic disturbances, sleep disorders, and gait difficulty and postural instability that is not responsive to levodopa.
One of the main side effects is the on-off effect. This is when levodopa works for the patient, but only for so many hours.
Do you ever feel the on-off effect often associated with the levodopa medication?
Yes.
How does it affect you?
Well, it's as though your movement becomes less fluid, and you start to have tremors.
Dopamine agonists are one of the most common drugs used to help improve the side effects and symptoms. Dopamine agonists are very similar to L-Dopa, but instead of being converted to dopamine, they mimic the effects of dopamine. Levodopa and dopamine agonists are most often the first prescribed medications for patients and work best when accompanied with one another. These medications are preferred because of their ability to make the day a little smoother for patients and avoid the on-off effects that occur when using levodopa.
Medications such as levodopa, dopamine agonists, and many others are used to help patients manage their symptoms, mainly tremors, at a level that interrupts their daily lives the least. Scientists and doctors are exploring more treatments every day by working with patients, completing research, and doing clinical trials. The Michael J. Fox Foundation and the Parkinson's Disease Foundation are only two of many organizations that have devoted their time, energy, and millions of dollars to help search for a cure for Parkinson's disease. One organization in particular that has made huge strides for people living with PD and has brought Parkinson's disease to the attention of millions is the Michael J. Fox Foundation. In the last 15 years, they have raised over $450 million for clinical trials and research. Their goal is to, quote, eliminate Parkinson's disease in our lifetime. To do so, doctors and scientists are exploring the genetics of the disease and working to discover if there is a connection. They are also developing drugs to help modify the disease by working with the biological components. The hope is that this will help slow down or even stop the progression of the disease. Michael J. Fox explains what his foundation hopes in accomplishing for the disease and the research that will get them there.
What we're trying to do in our foundation is we're trying to find biomarkers and ways to identify the disease before it's present, its symptoms are present. And we're trying to, in connection with that, we're trying to find genetic links to it. And we know, for example, that Ashkenazi Jews have a higher likelihood of having this gene called LRRK2 gene, which we're working on doing research into that link and encouraging that community to call Fox Trial Finder.
The Michael J. Fox Foundation is also currently working on creating a vaccine with antibodies to counteract the disease, along with hundreds of other clinical trials in progress.
What I understand about your foundation, you have to give this money to drug companies, so then they will do the heavy lifting. They will then do the research and the trials and on and on.
Many organizations like the Michael J. Fox Foundation are vigorously working to find a cure for this horribly progressive disease. We have come a long way in research since 1817, when James Parkinson made his initial observations about the disease. Hundreds of scientists, doctors, and researchers have been exploring the disease for years, leading them to encounter new information about drugs and treatments. The exchange of data has created drugs like levodopa and formed hundreds of clinical trials and research groups that will lead to a cure to help the millions of people and families affected by the disease.